This, whatever. Anywho, I initiated the methotrexate treatment. I got it in my thighs because it has to be great muscles, big muscles. And I got it in my thighs, one side each. Then my side effect was horrible headaches. My headaches was through the roof. But then I was also having these type of headaches before the methotrexate treatment. So my headache could have been because of the ectopic pregnancy anyways. Um, it just got intense when I started the methotrexate treatment. Then, after that, I went back 2 days, and my ACG level only dropped by 15. Now it's supposed to fall by 15% each time you get it. It only dropped by 15 points, right? So I had to get another shot of methotrexate, another shot. And I hate injections. Yes, I'm a nurse, but I hate receiving injections myself, especially in great muscles. So I went there, got the methotrexate shot a second time. My levels did go down, um, this time by the 15%. Then they called me in again to have my, to get my blood work, because with the methotrexate, because it's a chemotherapeutic drug, they have to check your liver and other functions, the other organs function, and just in general to see your overall well-being. But I think I must say the saddest part about where I am and getting the methotrexate treatment was that it all happened in the same unit with people who are giving birth. So I'm sitting there having a methotrexate treatment to resolve my ectopic pregnancy, and somebody else is coming in to give a live birth. So it kind of played on my emotions, especially that I wanted this pregnancy. It was a pregnancy that I wanted. Me and my partner, we wanted this. But it didn't happen accordingly, and then it's just, now I can say it is what it is. But it was hard on me mentally. Because as a woman, or just as a person, as a human being, you just don't expect something like that unless you go out to have an abortion. But this wasn't the case. Um, so yes, having the first time I went to have my methotrexate shot, a lady came in. She was in the next room beside me. She gave birth. I was so happy and so sad at the same time. I was so happy to hear that baby crying, but I was so sad at the same time. I was just like applauding. I was just so happy, but my heart hurt so badly. The other times was during the daytime that I went, because I was like, no, I'm not going to go in the nighttime. Too much drama was going on in the maternity ward. Too much things was happening. So let me go earlier. I went in the daytime and people came in. What was more encouraging was to hear other stories from other people who had ectopic pregnancy and then went on to have successful pregnancies after that. So I've only had one menstrual cycle so far. I bled for the whole month of April, the whole month of April, like non-stop bleeding. I had my last true pregnancy. This is now June 1st. I had my last true period in May, and I felt that I ovulated, so I know I can, I think my rhythm is coming back on. And they said that you should wait 3 menstrual cycles to try and get pregnant again. So this is my first menstrual cycle, and I don't think I'm going to try after 3 menstrual cycles. I'll probably try after my sixth, you know? Because yes, I told myself I need to get back in shape. I need to get myself ready. But then sometimes I think to myself, maybe I should have opted to do the surgery to get, because what if I have another ectopic pregnancy with my left tube? So maybe I should have taken that tube away to reduce the chance of it happening again in my left tube. But I have a HSG to be done, which is where they put the dye up in your uterus. It finds out to your fallopian tube to see where the blockage is and if there's a blockage. I was supposed to call them this month, like in May, when I had my first period, but I didn't because I just wouldn't want to be involved. So maybe for my next period, I will give them a call and schedule to have my HSG done. But it really is a mental process. It really is very stressful. It's very good to have support. Um, I did have emotional support from my girlfriends who live in Jamaica. I did have support from my mother, from my aunt, from my fiance. I did have support from him. So that's very good. And it's very, and my 5 year old, she supported me too. But, and then visiting the hospital back and forth like every other day to get blood works drawn, that's very stressful too, especially if you have a busy life. So that added on to the ectopic pregnancy and the methotrexate situation. Most people don't have side effect from the methotrexate because it's a low dose. It's not like the full chemotherapy dose. It's a very low dose, but you still can have. My very first day of having the methotrexate treatment, I felt like I couldn't taste anything. I had no taste in my mouth. Nothing tasted. Everything tasted like nothing, you know? So yes, that was the very first time, and then after that I just was sleeping. I was just sleeping away, and then the migraine came. My doctors told me to not go far from the hospital, stay within the region, um, not do heavy lifting, heavy bending, nothing heavy like that in the event of a rupture, because you are not free from the event of, like, from the possibility of a rupture until your HCG is below 5, till it's normal. And normal and not being pregnant is 0 to 5, you know. My level went down to 1.28. So that it was good. You know, I didn't drop as quick as they would want me to drop. I dropped. It took me 3 weeks to drop to a level that is lower than, that is considered not pregnant. Um, after my, like, after 2 days of getting my first methotrexate is when the severe headache started. Before, it was just like a headache, but it wasn't like a severe headache, if you know what I mean. But after the methotrexate, it definitely intense. Now, the other thing that I wanted to mention was, now looking back at the pregnancy, I should have known for real that something was wrong, because um, apart from the intense headache, at some point I feel like I was having fever on and off, um, belly cramps. But these were all, to me, these were signs of just early pregnancy. Just, it was just being pregnant, you know. But there was a point, like 3 days before I started bleeding, where I just didn't feel pregnant anymore. You know, I just didn't feel pregnant. Maybe 3 or 4 days before I started bleeding, I just didn't feel pregnant. Like, I didn't feel my breast. Like, my overall being wasn't that of being pregnant. And also, my pregnancy test, when I was pregnant with my daughter, and I did the urine test, it showed up right away, right? But with this pregnancy, it took maybe like within that 5 minutes, like the last part of the 5 minutes, to show up on the test. And it was with every test, even the digital test. It said no, and then I don't know, I looked at it again, and then it said yes. And then all the tests that I did after that, it took a couple minutes to really show up, even when I was like, and then when I was 5 weeks pregnant, I retested, because as I said, I wasn't feeling pregnant. So I retested just to make sure that I was still pregnant. And at 5 weeks, it took forever to show up. You know, it took forever to show up on the test. And it started to show up, but it's when it was showing, even though it started to show up later, or it didn't show up as fast as with my daughter, it showed up bright. But, and I did have a dream too. I had a dream, and I'm gonna tell you guys about the dream another time. But I just wanted to share my experience, because I don't think there's a lot of experiences on the methotrexate on YouTube. So I just wanted to give my inputs and what I went through with it. So yeah, and my name is Jade, by the way. I didn't introduce myself. And that's my methotrexate incident this year.